into the fourth of the talks in this session, which is really about that application of research into policy, and perhaps part of the engine of getting the profile for public health in Cambridge that the Vice-Chancellor mentioned. So we have a double act, and it looks as though starting is Rob Doubleday from the Centre for Science and Policy, who is sharing the session with Hilary Burton from the Public Health Genomics Foundation. So, Rob.
Thank you very much, and thank you for inviting us here. Hilary from, as you heard, the PhD Foundation, and myself each have 5 minutes to briefly introduce you to the sort of things we do. And as the title suggests, what we are looking at is linking research to policy. So not necessarily specifically within the realm of public health, but we hope what we talk about will be relevant to the development of the network, and we'll see where it goes. I think all of you will probably know from your own experience that translating research knowledge into various contexts of application is not trivial. I mean, if you think about it from your own experience, you'll realize that. And what we'll talk about is really two different approaches to actually facilitating this interaction, particularly with respect to policy. So the Centre for Science and Policy was set up in 2009 by the University of Cambridge to try and help build connections between academic research and expertise at this university and public policy, government in particular, but public policy in general, with the idea of trying to improve these kind of connections and make better use of the kinds of resources that the university has to improve public policy. And it started from, the centre started from a couple of assumptions. Well, three, let's say. One is that it's not a trivial business, this translation. It takes time and it takes effort. And two, that an important vector, if you like to use this language, of knowledge transfer is individuals, humans. And in order to support that and increase that knowledge exchange, the centre invests a lot of time in building up human networks, investing in establishing relations that cross between university and government. And thirdly, from within the university, an important way that we can build these networks is to try as far as possible to respond to the kinds of questions and needs that people in public policy have, rather than the mode of going out and telling them, look, we have this wonderful thing that you ought to be interested in, that you ought to understand. Start from the other point of view and say, what is it that you're struggling with in a day-to-day basis that you think might be helped if you had access to the resources of a university. So there are the three starting points that the centre works with. And just to say a little bit, and I'm going to talk in a little bit more detail about the first, the policy fellowships, which is what the centre does to build up these networks. And then the second thing we try and do is run kind of events and spend a bit of time thinking about policy questions, taking advantage of the networks that have been established through the policy fellowships, and then begin to use these interactions and these networks to study how and get a better understanding of how knowledge is generated and used at the intersection of academic research and public policy. But the one thing I really want to dwell on for a moment is the Centre's Policy Fellowship Programme. And this is a diagrammatic representation of the fellowship during 2012. And so we have now about in the order of 35 fellows a year that come in from the policy world or from industry if they work in policy relevant domains, come into the university, and they have a 2-year association with the university as policy fellows of the Centre for Science and Policy. But their association begins with 5 intense days of one-to-one meetings with academics and others that we sort of convene for them, addressing questions that the policy fellows bring. Okay, and so in total, we've now had just over 80 policy fellows enter the system, and they've met about 600 plus academics and others. And here you'll see for 2012, about this proportion come from UK government departments, this proportion come from the European Commission, this group here coming from business, and a little bit of a growing kind of group here coming from third sector and elsewhere, meeting, just to give you a very rough idea, biological and clinical sciences, physical sciences and technology, arts, humanities, social sciences, and then other, and then other here. So these are people outside the university. And this has proved a productive way of building up these kinds of connections. So the policy fellows now have developed an understanding of the kinds of research that this university and other universities does, and begin for them to develop, if you like, a network, people they know they can call on. And vice versa, we also hope that that is also the case among academics. And we all know, of course, that there are some academics who are deeply and extremely well connected. Likewise, there are some people working in government who are deeply and extremely well connected with academia. But these are the exceptions, we believe. And so this kind of approach extends that. And, you know, so what can we do now that these networks are in place? Just to give three very quick illustrations before I hand over to Hilary. Last week, this is the sort of thing that this network can now generate, so last week, for example, we had a policy fellow come. He's a special advisor to the Deputy Prime Minister and David Laws, spent a couple of days in the university last week, and one of the questions he asked was, for example, he has no background in this area, but wanted to know what is the sort of evidence about the relationship between diet and activity and educational attainment. So that's the kind of question they come to Cambridge with, and hopefully they're the kinds of conversations that can help him answer that in a way that's useful to his job. Also last week, some of these can lead to, there were some policy fellows that came in and talked to people about another question, and hopefully that will lead to collaboration on a bid for a doctoral training centre where this is a part of government that can use the kinds of knowledge that the PhD students will be trained in. And then the third example from last week I was going to give was the policy fellows here also, we try and create opportunities for them to interact with each other. So last week we set a date for a few months' time now for a workshop that will bring together policymakers from 3 government departments that have an interest in housing and in government intervention to improve housing with academics. And so we can start to use this network to, if you like, ask new questions and find new ways of supporting interaction between academic research and policy. So that's a quick introduction to the kind of thing CSAP does, and now Hilary, I think, will take over and give you a bit of a flavour for what PhD can do.
Thanks, Rob, then. So in putting this double act together, we thought of ourselves as being 2 organisations that work very closely together. In Cambridge, the Centre for Science and Policy very much building up a set of resources for policy work in Cambridge, and the Public Health Genomics Foundation being an organisation that really undertakes policy in one particular area of the life sciences and medicine. So the PhD Foundation is the leaf that wasn't quite connected in the Institute of Public Health diagram that Carol showed us, and I think possibly the reason that she thought that way, or that it ended up on the diagram, is that we are an independent organisation and we're a not-for-profit organisation, so we're not quite in the same mould as many of the university organisations, but we are definitely part of the Institute of Public Health, and we're definitely part of public health at Cambridge. So we're focused on the responsible translation of biomedical sciences for better health. Our origins are definitely within standard public health practice, but we're trying to use genomic science to actually make a difference for population health. And our basic premise is, as Rob said, that translation needs active processes. It doesn't just happen because people have done the science and published in a journal. It actually needs to be translated into different public health practices, different health services, and much wider regulatory and other practices. What we really always need to do is involve many disciplines, so not only the scientists but also the clinicians, ethicists, philosophers, social scientists, and public health at Cambridge is going to give us a fantastic opportunity to network with so many different people. I've just got a couple of examples of translational work that we've done recently. At the bottom, the work on free fetal DNA technologies. I think it's now 1997 that Professor Dennis Lowe, now in Hong Kong, discovered that there was free fetal DNA within the maternal blood circulation within about 7 weeks of pregnancy. It took about another 10 years for that to start to be really getting into clinical applications, but at that point we realized that was going to be really important. If people can diagnose and find out all sorts of things about their fetus 7 weeks in pregnancy without even going to a medical practitioner, possibly over the internet, this was going to have the most fantastic ramifications. So think of it from a public health point of view. The Down syndrome screening program, all nicely organized based on triple testing and nuchal translucency and so on, was going to need to be overhauled. Think about it from people wanting to just find out the sex of their fetus, perhaps for social reasons, or in various countries across the world. So a real translational piece of work. More recently, we've been doing work on whole genome sequencing. Again, we realized this was going to be a paradigm-shifting technology, and 2 years ago we published a major piece on what the new sequencing technologies could achieve for what clinical applications there would be, including infectious disease, pathogen sequencing, and also thinking about how that would be integrated into practice and what the social implications might be, how people might use it. And many of you will know that the government just in January announced the 100,000 Genomes Project, which is a part in a response to this sort of work, because they realised this was going to be a fantastic opportunity for the NHS, so 100,000 genomes that are going to be funded. So again, we've had quite a lot of input into that development. So how do we influence policy? We say that that's not only health services that we need to influence. We would get involved with things like the configuration of health services, public health services. We've done work on risk stratification and how that might help our preventive options. You need to be involved with regulatory policy, ethical frameworks, so we're going to be concerned about consent and confidentiality. We need to be able to influence research and educational policies. We need to be concerned with commercial, voluntary and the public sector. So, for example, we've done a lot of work with voluntary organisations to do with rare diseases over the years that have been trying to really develop health services and research programmes for rare disorders. And how do we influence them? We need to be ahead of the game all the time. We need to be understanding what new sciences are going to are emerging and how they can be used, but also the wider trends. So Carol mentioned the interest in big data, for example. How is big data going to impinge on our research and our applications? What about social media? We get involved in formal policy work. We do a lot of committee work. We do a lot of work on response to consultations and so on. We build a wide set of networks, as Rob was saying, and we do active knowledge brokering and advocacy. So that's just a little bit of an example about what we do at the Public Health Genomics Foundation. So Rob and I wanted to just finish with some conclusions about public health at Cambridge and how that needs to operate. Because I think we need to really be sure that the research evidence really does contribute to public policy, but in order to do that, we have to be able between us to make the commitment and to commit resources and time to actually doing that. Centre for Science and Policy facilitates this interaction between researchers and policymakers, and I think the PHG Foundation perhaps sets a bit of an example of how you can actually use policy research to make a difference in life sciences and medicine. So we think that public health at Cambridge is a fantastic, exciting opportunity. We think it's going to be wonderful for the sort of multidisciplinary research that we want to do, and we want to really focus that to improve public health policy and practice and to really make a difference in the UK and worldwide. Thank you.